Good afternoon. Today we're going to present chronic depression in kids based in nutrition and behavioral health disorders, depression, and anxiety. Depression is a common and serious mental disorder that negatively affects how you feel, think, act, and perceive the world. The diagnosis criteria is based in DSM-5, and some symptoms are low mood, loss of interest, feelings of guilt or low self-worth. In anxiety, is a persistent, excessive, and unrealistic worry about everyday occurrences and are based on criteria. The diagnosis criteria is DSM-5, and some symptoms are feeling nervous, restless, or tense. Population burden and features of depression and anxiety. Depression. Preventing depression disorders is a global public health priority because of the high prevalence. Depression disorder include major depressive disorder, dysthymia, and bipolar disorder. Are complex and have no simple cause, and have a variety of factors that may contribute to increased risk. Some of them are sex, gender, socioeconomic status, social support, stress, alcohol, and drug use. Microbiome and depression are associated with the development, and however, causative have yet to be established. Anxiety disorder is not one particular disorder. It clusters around excessive irrational fear and dread. Approximately 31.1% of the US population has experienced an anxiety disorder in their lifetime. It's higher in women compared with men. It's highest from childhood through middle age. And nutrition, including dietary patterns, foods, and individual nutrients, affect anxiety. Chronic stress may decrease synthesis of neurotransmitters, which may increase the risk of severe anxiety. Nutrients also affect neuronal membrane structure and neurotransmitter release. Dietary patterns in depression and anxiety. In depression, diet is a modifiable risk factor. The SMILES RCT was the first RCT to explicitly evaluate whether improving diet quality improved symptoms of depression. The DASH diet have also improved depression symptoms, and the vegetarian dietary patterns have been associated with increased and decreased risk of depression. However, low levels of meat consumption have been related to increased risk of depression in cross-sectional analysis. In anxiety, the SMILES RCT demonstrated that individual nutrition consenting to follow a modified Mediterranean dietary pattern reduced anxiety. Traditional dietary patterns in Australia and the Mediterranean diet have been associated with a lower risk for anxiety disorder, and greater adherence to lacto-vegetarian dietary pattern is associated with decreased odds of anxiety.
Now let's talk about macronutrients and depression and anxiety. Macronutrients serve as the building blocks for energy production and neurotransmitter synthesis, both of which are essential for brain function and mood regulation. For example, carbohydrates increase the availability of tryptophan in the brain, which is a precursor of serotonin, a key neurotransmitter involved in mood regulation. A low carbohydrate diet may reduce serotonin levels. This can lead to feelings of sadness, irritability, and fatigue. A diet rich in whole grains, fruits, and vegetables promotes serotonin production and stabilizes blood sugar levels, improving mood and reducing depressive symptoms. Now, talking about proteins, these ones provide amino acids like tryptophan, tyrosine, and phenylalanine, which are necessary for the synthesis of neurotransmitters like serotonin, dopamine, and norepinephrine. All of these involved in mood and emotional balance. Consuming lean meats, eggs, and legumes help increase dopamine and serotonin levels, which can enhance mood and motivation. A low protein intake may result in reduced neurotransmitter synthesis, contributing to feelings of fatigue and depression. Now, let's talk about fats. Omega-3 fatty acids, especially EPA and DHA, are essential for maintaining the integrity of neuronal cell membranes and regulating inflammation. Omega-3s also enhance the production of brain-derived neurotrophic factor, which supports neuroplasticity and resilience against stress. Diets rich in fatty fish like salmon, also flax seeds and walnuts, have been linked to lower rates of depression. Now let's talk about micronutrients. Vitamin D modulates the hypothalamic pituitary adrenal axis and reduces inflammation. Low vitamin D levels are associated with impaired serotonin, and a randomized control trial found that individuals with low vitamin D levels had a higher risk of depression and anxiety, and supplementation improved mood in vitamin D deficient patients. Supplementation of about 1,000 and 2,000 units per day improves mood and reduces anxiety. Now, magnesium. A clinical trial showed that magnesium supplementation improved depressive symptoms within 2 weeks, especially in individuals with mild to moderate depression. Magnesium supports NMDA receptor function and reduces hyperexcitability linked to anxiety and depression. Supplementation with 3,000 and 4,000 milligrams per day has been shown to reduce anxiety and improve sleep quality. Now let's talk about B vitamins. A longitudinal study found that folate and B12 deficiencies were linked to higher depression and anxiety rates. B2 and folate are involved in homocysteine metabolism. The elevated homocysteine is neurotoxic and linked to mood disorders. Last but not least, let's talk about zinc. Zinc has been shown in a meta-analysis found that zinc levels were consistently lower in individuals with depression. Zinc supplementation enhanced the effect of SSRIs, selective serotonin reuptake inhibitors. Zinc supplementation enhances antidepressant effects and reduces anxious behavior.
What you eat has a direct impact on your mental health. Let's break down how your diet can help with anxiety and depression. So for depression, while supplements alone aren't proven to prevent depression, studies show that the Mediterranean diet and other healthy eating patterns can help. This means focusing on olive oil, vegetables, fruits, nuts, whole grains, and lean proteins while cutting back on added sugars and saturated fats. Getting enough omega-3, vitamin B12, magnesium, and zinc is also crucial since deficiencies in these nutrients have been linked to a higher risk of depression. Some groups like vegans and older adults may need supplements to avoid these deficiencies. And for anxiety, certain nutrients have been shown to help reduce anxiety, like omega-3 fatty acids from fatty fish, along with magnesium and zinc, play a key role. Vitamin B, C, and E, as well as the amino acid lysine and arginine, can also be beneficial. And a balanced diet that includes these nutrients can make a real difference for mental health. So, for preventing these diseases, you can add more fish, nuts, and vegetables to your meals.